So I've got 101, so we'll go ahead and get started. My name is Kathy Brown with Easter Seals Midwest. Easter Seals Midwest serves over 5,000 children and adults with disabilities all across the state of Missouri, also in Kansas and parts of Illinois. We're so happy to welcome you and bring you this opportunity from the Missouri Foundation for Health to bring us some information about a ballot initiative that will come before you on August 4th. And I would be so happy to introduce our board member, Rakaya Bailey. Rakaya is new to Easter Seals Midwest Board. She was instrumental in bringing our attention to this issue and bringing you this webinar today. So thank you, Rakaya. And I will kick it over to you with one small housekeeping. If you have questions, please use the Zoom webinar chat feature to give your questions to the panelists. I think that Nancy with Missouri Foundation for Health will pause periodically to answer questions. We will have an opportunity towards the end for a question and answer session. So as you're thinking of questions, please use the chat feature as opposed to the Q&A feature so we can keep all those questions in one place. And with that, I'll hand it over to Rakaya.
Hi, everyone. I would like to introduce Nancy Kelly from the Department of Foundation from the State Missouri Foundation for Health.
Great. Thank you, Rakaya.
You're welcome.
Okay, if everyone can hear me, this is Nancy Kelly, as Rakaya stated. I am a lead strategist for initiatives at Missouri Foundation for Health. And I greatly appreciate you all taking time to join this webinar today. And what we hope to talk about is Mo HealthNet, which a lot of you know is the name that we have for Missouri's Medicaid program. And really what I'd love to highlight today is, I guess, in three parts. One is some basics about Medicaid. Some of you know a lot of this and some of it will be new, but it's kind of nice to have a refresher about the program. So what is Medicaid? What are the benefits of Medicaid expansion, both to the state of Missouri, our economy, and the health system, plus for individuals? What are those benefits? And then third, I want to give you some tools and resources and really introduce the educational campaign that Missouri Foundation for Health has developed. And we've really been trying to help people, other Missourians, to understand and to have tools to share with beyond, social media and all that, in order to spread the word about how Medicaid might help those of us that are in Missouri. So I'm going to take just a minute and share my screen. Okay, and I'm wondering why my slideshow is not starting. Okay, I am hoping that you can see the slides. You should see Medicaid expansion in Missouri and our logo and our state capital there. So before I do jump in specifically to the Medicaid program, just in case anyone is not familiar with Missouri Foundation for Health, we are a private nonprofit foundation that has the mission to improve the health and well-being of individuals and communities most in need. Missouri Foundation for Health really strives to be a resource for the region, and we work with communities and nonprofits to generate and accelerate positive changes in health. A lot of people are familiar with the funding that we do through our grants. That might be kind of the first thing people think of. But we also like to work side by side in partnership on projects through coalitions and other groups. We like to share expertise, both of our staff and outside experts, so really helping to bring extra knowledge to all of our partners so that we can mobilize all of the knowledge towards better changes in health. And then also, as we do that, the knowledge we share, we really aim to be nonpartisan and to be fact-based and best practices so that we all are moving together equipped with the policies and the practices that most will benefit our state. So Missouri's Medicaid program, MoHealthNet, is its formal name. It is a government program, and it provides health insurance to many low-income children, parents, seniors, pregnant women, people with disabilities, as you well know. So it does all of the things that a health insurance package would do for anyone like that may have it through their employer. So go to the doctor, get your medications, go to the hospital, get the care when they're sick, when a person is sick or needs that care. It's really important to remember too that Medicaid is it's a partnership program between the federal government and the state government, and this is both on the administration of all of the activities and the policies, as well as the financing of the program. And if a person is familiar with Medicaid that happens to touch their own family, you could be pretty familiar with that piece of it. But big picture, if you pull the lens out, almost 1 million people in Missouri are part of the Medicaid program. So 976,000 Missourians are enrolled in the program at this point. And that is really across the spectrum, particularly highlighted here is the spectrum of age. So Medicaid covers 45% of Missouri's children, and it pays for 38% of all births in the state. And so that's more than 1 in 3 babies that are born are their hospital and their time coming into the world paid for by Medicaid. Also, if you look at the other end of the age spectrum a little bit, it covers 1 out of every 13 adults age 65 and over. And not everyone that is in a nursing home is older, but Medicaid does pay for 65% of all nursing home care in the state. So again, 2 out of 3 nursing home care services are paid for through Medicaid. So it's important as we think about Medicaid to realize that it's got one big name, but it's got several different ways that people can be eligible. So there are categories. Certainly, as we walk through from left to right on this slide, children have the highest level of income that their family can have and still qualify. This is at 305% of the federal poverty level. So a couple things I will say about that. Number one, the federal poverty level for Medicaid, to figure this, is $12,760. So we'll kind of come back to that number in case you're not familiar with it. $12,760 is the federal poverty level to be eligible for Medicaid in Missouri in 2020. So children 0 to 18, families can make up to 3 times that essentially and still qualify, although there are premiums that are built in along the way. So as a family comes closer to that 300%, they're paying some amount every month for their coverage. The next group that has the highest eligibility level are pregnant women at 200% of federal poverty level. And then what's often lumped together, the elderly, blind, disabled, sort of special programs within Medicaid. those are at 100 or just under 100% of federal poverty level in terms of income. And then the two that we will talk about, especially today, although I know there's some questions related to people living with disabilities, which I will attempt to answer. And if there are questions I don't know, I will certainly look and ask the experts. Some of my colleagues may have the answers. So please don't hesitate to ask those questions. So parents only qualify for Medicaid at 22% of the federal poverty level. So parents, very low amount. We're going to talk a little bit more about that in upcoming slides. And then important to notice that childless adult, so a person that doesn't have a disability or is not elderly or blind, but a childless adult, is not eligible at any income level. So when we think about a parent with kids, I just said it was 22% of the federal poverty level. So if we look on this chart at the column and the row and column that says 4, and then underneath it, it's $5,546. A mom with 3 kids cannot make more than $5,546 a year and still qualify for Medicaid. So if you think about our minimum wage in Missouri is $8.60. If that mom works more than 13 hours a week at that minimum wage, she would earn too much to qualify for Medicaid. So in fact, Medicaid in Missouri, that eligibility for this group for parents is the lowest. It's the bare minimum that the federal government will allow for eligibility within the program. So as you might imagine, this puts that mom and other parents like her in a pretty tough spot at times, because let's picture the scenario of the mom is at her work site, she is working, and she is offered additional hours. Well, that's great because now she can earn a little bit more money to support her family. But then if she takes on those hours, she's going to jeopardize her health coverage because it's going to push her over this $5,546 a year. And she's going to have to make a really tough choice between saying no to the hours and keeping her health insurance, or saying yes to the hours and likely losing that Medicaid coverage. So there's one more thing that I want to talk about specifically around Medicaid in general, but I do want to also mention a resource for you. Missouri Foundation for Health just about every year puts out, and we're waiting for 2020 to come out, but we put out a Medicaid Basics booklet. It's available electronically online on our website, which is mffh.org. So it's called Medicaid Basics, and it walks through all kinds of stuff in more detail, all kinds of information about eligibility, about how the program is paid for, what parts of the government or the state's budget goes towards Medicaid, and much, much more. So if you are interested in that kind of background information, I would definitely encourage you to go to mffh.org and look for Medicaid Basics. One other thing that I would like to talk about is the coverage gap. And so some of you may have seen this graphic before, particularly if you have worked with any of the Affordable Care Act marketplace healthcare.gov coverage, or if you have helped people to enroll in Medicaid in the past. But the coverage gap is something that is a very real and difficult situation for people who essentially make too much money for Medicaid, but they don't earn enough to qualify for the ACA's marketplace subsidies. So across this slide, when we go to the far left, that one man that's standing there, he's that childless adult, and he is not qualifying no matter what. So he's kind of left out, even not even under the umbrella. So then we have Medicaid, where we have the specific groups, such as those parents at 22%. And this would be also people who fall into the categories of pregnant, children, and elderly, blind, or disabled in those pieces of the program. Then in the middle are people that don't have coverage. So it's like that mom who took on the extra hours. Now she's not in Medicaid anymore. It's everyone who is typically working because there is income there. In fact, the majority of people who would benefit from expansion and that fall into this coverage gap are employed. It's just that they earn too much for current Medicaid eligibility, but not enough to make health insurance affordable through the marketplace. So as we move forward, that dotted line that's coming down, that's 100% of the federal poverty level. Again, you see that's $12,760. And this is really for the purposes of Medicaid eligibility. There's some tweaks to federal poverty level for some other programs, but I don't want to go into that. Let's use this number right here. So marketplace subsidies. So this is a lot of people know it as Obamacare. It's the Affordable Care Act coverage that people would go to healthcare.gov and look at what their options are. And what happens at 100% of federal poverty level, up to 400% on a sliding scale, is there are financial, different types of financial assistance that make health coverage much more affordable. So there are two main parts of financial help. One is tax credits. So this is what is going to reduce that monthly premium for someone. And really, starting out at 100% of federal poverty level, a lot of people find that they are going to have $0 premiums per month, or maybe it's $20 a month, which is still, something when you're only earning $12,760, but it's way more affordable than, hundreds of dollars that others may pay if they buy marketplace or they buy coverage straight from an insurance company. So the tax credits really do help at the low end, up to 400% of federal poverty level. Those tax credits get smaller as someone starts earning more money up to that 400%. The other piece of financial assistance that's really valuable is cost sharing reductions. So people at 100% to 250% of federal poverty level, so they're in that light blue area, they also are getting help with copays and out-of-pocket expenses, so they can actually afford to use their insurance. Because if someone gets coverage, but it's like, oh, well, there's a $50 copay for the specialist, and your medication is $100. Well, that's going to price them out. So those cost-sharing reductions really do reduce the cost out of pocket. But so that's more than maybe you wanted to know about the marketplace piece, but really the important thing for the purposes of this presentation is that group in the middle, the orange, who fall into that coverage gap. So I'm going to stop here for a minute and see if there are any questions that people have thought of that I don't see any in the chat yet. But I'm going to pause here for just a minute and see. Okay, I'm going to go on to Medicaid expansion. So many of you are probably aware that Missouri voters do have the opportunity to expand eligibility for MoHealthNet for Medicaid up to 138% of the federal poverty level. And this is through a ballot initiative that will be at the election on August the 4th. So really just 2 weeks from today. With expansion, an individual earning $18,000 a year, that could be a childless adult, or a family of 4, like that mom with the 3 kids, she can earn up to $36,000 and would still be eligible. If Medicaid is expanded, it's expected that 230,000 more Missourians, again, those people in the coverage gap, people who are already working, but their employer doesn't offer coverage, they can't afford it out of pocket. 230,000 people are expected to be qualified and to enroll if Medicaid were to expand. One other thing that I will say is that sometimes you may hear, if you're really paying attention to the details, I said 138%. You also may hear 133%. For those of you who are really familiar with the eligibility for Medicaid will know that there is a 5% sort of set aside. So when income is being considered, the first 5% is set aside and it's not counted. And so it's that 5% plus the 133% that's in the ACA, that's in the law that would expand Medicaid. Add those together, 5%, 133, that's where we come to the 138. And I use 138, and Missouri Foundation for Health uses 138 because it's more of a real number. Like that's the real number that someone is going to have to hit in order to qualify for the program. So as you can see, we're revisiting our bar chart here, and there's a big change for two of our groups. So children over through the disabled columns, all the same. However, parents, their income can boost up to 138%, and that's the 138%, and then the childless adults also 138%. And so again, that's about $18,000 for a person without any kids. So it's important to note that the federal government will pay 90% of this cost, which means that there's a 9-to-1 return to Missourians and Missouri as Missouri is budgeting for this. And we'll talk a little bit more about that in a minute as we go forward on other slides. So if we zoom the lens out just a little bit and we look at the whole United States, just to put Missouri into context with our neighboring states and other states, on this slide you see the darker blue. Those are all the states that have adopted Medicaid expansion, and there's actually a correction that needs to be on this slide, which Oklahoma, which is bordering on Missouri, they're above Texas. Oklahoma, just at the end of June, their voters did hold a ballot initiative and they did approve expansion. So Oklahoma needs to flip to blue. We need to update this slide. You'll also see that Missouri is in a minority now. The orange are the states that have not yet adopted Medicaid expansion. And so there's 37 that have and 13 that have not. One thing that really is important to keep in mind is that we all pay federal taxes, including in Missouri, but no dollars are coming back to Missouri for our Medicaid program. Instead, our money is going to all those other states that are blue that have already expanded their programs. So we believe that Missouri is really missing out, and both on the dollars themselves, but then on better health and benefits for Missourians. So there are benefits to on multiple levels in terms of Medicaid expansion, and we feel like Medicaid expansion makes sense on these multiple levels. I'll talk a little bit more in detail about each one, but it helps grow our economy. It helps the state budget. It improves health and access to care. And it also goes a long way to sustain rural hospitals and the communities surrounding them. So in terms of job growth, there have been some studies, and if you have questions about those, I can talk a little bit more, but there have been multiple studies, including one that has recently been commissioned by Missouri Foundation for Health to find out what would be the economic impact, particularly on jobs for Missouri. Well, what was found was that over 16,000 new jobs would be created on average each year as a result of Medicaid expansion. And as you drill in and you look at what kind of jobs those are, you would think they might all be in healthcare, but they aren't. Actually, 79% of the new jobs will be outside of the healthcare industry. Why is that? Well, if you think about a hospital and Medicaid expands and the hospital says, you know what, we've got more people coming in and they need this new service that we don't currently provide. So let's build out, let's add some to our building. So that's construction. Maybe we need a new driveway and a new parking lot. So that's some more construction. We're going to have to buy equipment. We're going to have to hire new staff. And then the new staff, well, they're going to move to the area. They're going to get an apartment. They're going to buy a car. They're going to spend their money at the restaurants. So you start thinking out, what is the economic impact when Medicaid expansion puts more money into the economy to do these things? And as we think about those jobs, they are considered to be quality jobs. So 9 out of 10 of those jobs that are going to be created are $15 an hour or more, and they are full time. And then the last thing that I will say specifically about jobs is that about 2/3, 63%, would be outside of Kansas City and St. Louis. So it's going to be a benefit across the state in rural and more urban areas. And so sometimes in Missouri, we have an emphasis on those large metropolitan areas, but this one, this would have effects across the state. As we look at the economy in terms of expanding Medicaid, it makes sense for our state for a couple of different reasons. So it is estimated that the economic output would increase by 2.5 billion, that's billion with a B, and personal income collectively would increase by 1.1 billion every year between 2022 and 2026. And so the reason that the studies looked at 2022 to 2026 is it takes a little while for Medicaid to be implemented. So Medicaid, if it would pass in August, it would be implemented in 2021. And then the economic benefits would really start being strengthened and in full swing by 2022. And as even though that is a little bit farther out, we certainly are in an economic challenging time. And as we continue to deal with the economic effects of COVID-19, any measure that is going to kickstart and strengthen and continue to build our economy, we feel makes sense for the state. So I mentioned briefly before that the federal government would cover 90% of the costs of Medicaid expansion. It's important to note too that this commitment is written into the law as a guarantee of this funding. The expansion of Medicaid comes from the Affordable Care Act, and within that, states were invited or welcomed to expand Medicaid, and it's a step down thing. So the first few years, 100% was paid for, gradually stepped down, and then now it's at 90%, and it's stopped reducing. It's going to be 90% from here up until, maybe if the future, if it's adjusted, but that would take an act of Congress and a signing by the president for that to happen. I'm going to pause, and it looks like there is a question. in the chat. So that question is from Lynn Unnerstall. Is there data from the states who have implemented expansion as to the jobs created, and does it go along with the projections? That is a really important question, and yes, there is data from all of the states that they've looked at different ways that Medicaid has impacted their economy and the health. The first thing to keep in mind is that of the 37 states, well, Oklahoma's pretty late into the game, but none of those states have changed their mind. Every single one of them has stayed with expansion. So that tells you something. But in terms, I don't have specific numbers for specific states, but this finding of the 16,000 jobs in Missouri aligned with and did not surprise those who know what those numbers are in other states. Okay, and we also have, there's a message about raising your hand if you do have a question. If for some reason typing into the chat is difficult for you, if you do want to raise your hand, I don't want to cut somebody off just because they're not good at typing into the chat, or they don't want to, or aren't sure how, or whatever the reason is. So we will try to address all of the questions any way that we can. Looks like that there is another question. This is from Austin. Hayden, hi there, Nancy. Will people with disabilities still have to qualify at 85% federal poverty level? Well, one of the questions that Kathy had shared with me that would likely come up is this exact question. So let's pause here and talk a little bit about that. So the answer is yes and no. If someone does get determined to have a disability and qualifies for Medicaid under that disability column, then the 85% federal poverty level is the same. But if someone chooses to not go through that disability determination process and decides that they're going to just apply for Medicaid like anybody else, just through the general program, then it would be through that 138%, if that makes sense. The reality is that the state can't compel anyone, force someone to get a disability determination and then drive them into that 85% category. So a person really would have that choice about which route would be more beneficial to them. So I hope that answers your question. Let me just go through right now while we're paused. So another question that Kathy had provided for me was, will the benefits be the same if someone with a disability qualifies for Medicaid under expansion, such as home and community-based services? So the answer is, if I'm going to call it regular Medicaid, that's not specific for someone with disabilities, whatever someone would qualify for under the broader Medicaid program would be what they would qualify for with expansion. And I'm not as familiar with the program, so I don't know. You all may know. If someone does, that would be helpful to chime in. But, quote, in regular Medicaid, whatever you qualify for, you would also qualify for under expansion. Now, of course, the state would have the option to change that and expand it as they would with any feature of the program. So another question is, there's currently a waiting list for disability waiver services. Does this impact this at all? Expansion itself is not going to have a direct impact on waiting lists. for the developmental disability waiver services. There is some evidence from other states that they may have been able to reduce their waiting lists because of some of the positive budget impacts, and we'll talk a little bit more about those in a minute. But since there's a little bit more money to work with, some states have chosen to sort of work through those waiting lists, but there won't be a direct effect just by expanding. So then the last question I have that Kathy provided ahead of time is, some of our staff are part-time or can't afford insurance. Will this cover them? And truly the short answer is yes. As long as they meet the income eligibility that we were just talking about. This is one of the biggest benefits of expansion. So people who may have jobs, but they're either part-time or their employer does not offer insurance, or someone is offered insurance, but they can't afford it, but they still fit in the eligibility, then yes, expansion is for them, up to 138% of the federal poverty level. Okay, I'm going to move on. If there are more questions, please don't hesitate to ask. There's our number, 238,000 people. And I do want to emphasize a couple of things. This is really an investment for all kinds of people. And so one of the things that we believe Medicaid expansion will do is to reduce some of the inequities in insurance coverage across race and ethnic groups, across income, and across age. And the benefits are just enormous in terms of enhancing access to all forms of care, primary care, preventive care, mental health, substance use treatment. In addition, when someone has coverage through Medicaid or private insurance, it's more likely that their prescriptions will be filled. They'll be able to follow through on management of chronic care, more access to things that are cancer care. In Medicaid expansion, again, studies that have been done in other states that have expanded reduce infant mortality, reduce deaths from cancer and kidney disease, and overall mortality. So, it just makes sense that people with Medicaid are healthier than someone who is uninsured for all of those reasons. And in addition, one more is that people who are uninsured very often delay or avoid their care because the cost can lead to more, because the cost. And so that, of course, can lead to more serious illnesses or illnesses that are more progressed and cause issues for someone health-wise and often pocketbook-wise as well. So before we jump into hospitals in particular, I do want to say just one more thing about the federal financing. We talked about it's a 90% federal match, so they're paying 90 cents for every dollar of services and costs for the program. And it really also will create some budget savings. So besides bringing in an estimated $1.1 billion from that 90%, it's also estimated that there would be $39 million in the first year in savings, and that is from a study that it was conducted by Washington University here in St. Louis. So one of the examples of that, there's a lot of different pieces that would sort of be combined to add up to that number of 39 million. But one example is related to a person who is currently institutionalized through the Department of Corrections. If that person has to go to the hospital, at this point, it is paid for at the current match rate, which is, I talked about 90%, 10%. Currently, we're at 65% the feds pay, 35% that Missouri pays. And so under the expansion, it would shift over to that 90-10 model. So it doesn't sound like much for one person, and it's, 25% savings for the state. But you think about all the people over time, multiple days in the hospital, that starts to add up. And again, adding that to other things related to substance use services and for pregnant women and some other situations, it saves the state, like I said, estimated $39 million. And again, this aligns with experience of other states, which typically have created state budget savings and increased revenue when they have expanded. So I see there's another question in the chat from Wendy Sullivan. If Medicaid expansion is approved by voters, will there be work requirements in order to be eligible? So short answer, no. Longer answer is, if our state legislators and governor come back in session, let's say this passes in August and we, implementation planning starts, implementation won't happen. The timeline that is written into the ballot initiative is by July of 2021, so within a year. If our legislators come back and introduce bills about work requirements for the expansion piece or any piece aid, then that would be something that, if it went all the way through, then there could possibly be work requirements, but it would actually be a separate activity, a separate action on the part of the legislature. Approve the work requirements. Okay, so that says, when will the change occur for the state's share to increase? I'm not sure I understand that question. As I was just saying, so if there's clarification, if I don't answer it, please ask again. But as I was stating, the timetable is the ballot initiative is this August 4th. Then implementation, there's a lot of planning, as you might imagine, that the state departments would have to work on. And then the State Department of Social Services would need to put together a plan that they submit to the federal government next March of 2021. Then the federal government would take a look at that and approve it. And then that would be implemented and people would start enrolling in July of 2021. So the additional information about the question is, when would Missouri have to start paying the 10%? Well, that 10% would be all the costs of services starting next July. So right now, for everything that is covered through Medicaid, we pay 35%. For the expanded services starting next July, we would only pay 10% of those costs. And I hope that's answered the question. So I'm going to move along so we can make sure that we get to all of the information. But I do want to talk about uncompensated care. If you think about someone who is uninsured and has to go to the hospital, there's an emergency, they go to the ER, they get treated, but then they can't pay. So that is called uncompensated care. It's care that is not paid for. So what happens is hospitals either have to sort of eat that cost through what they write off as charity care, or it does also result in higher premiums for people who do have coverage and higher costs for all of the care at the hospital as they're trying to balance out their kind of business model. So local hospitals would lose $6.8 billion in uncompensated care costs if we do not expand Medicaid expansion by 2021. And rural hospitals are particularly vulnerable In recent years, 7 Missouri rural hospitals have closed. And so you realize that this is a real crisis for people in terms of access to care, in terms of economic activity in that community. Hospitals are very often the hub. Hospitals and schools are often the major employers of a town. In fact, there's been a study that a small town hospital closure results in a decline of $1,000 per capita income for that community. So as we know, 37 states have expanded Medicaid, but most of the rural hospital closures that have happened in the United States have been in states like Missouri that have not expanded. And in fact, hospitals in non-expansion states are 6 times more likely to close than a rural hospital in a state that has already expanded. So I do want to say just a little bit about COVID-19 and Medicaid expansion. Certainly the pandemic has reinforced the kind of the understanding and the needs for such a safety net program for people who are in crisis. Hundreds of thousands of people have filed for unemployment. I think we're in the neighborhood of 700,000 people since the pandemic started in March and April. So a lot of people, along with their job loss, also lost their employer coverage. And not everyone is going to fall into the eligibility for Medicaid, but some will. And then the program is there to help keep them healthy and strong, and their family continuing to get the care they need as they're recovering economically. So I'm going to move into the campaign that we have, which is Medicaid expansion makes sense for Missouri. Captured on this slide is really everything that we've been talking about in terms of the eligibility and how many people, the 230,000 that will qualify, and how we can bring our taxpayer dollars back home. And we just feel like with the economic benefits and the health benefits, Medicaid expansion makes sense for Missouri. So you see down at the bottom of the slide, makesensemo.org is the website you can go to, or hashtag makesensemo. There is a lot of information there. There's a lot of resources that you can look at. There's toolkits. Here's a few examples. So a message guide that kind of walks through all the different talking points. So if you're having a conversation and you're like, oh, I forgot what Nancy said, but I wonder if I can continue to make that point to my friend, look at the message guide. It includes an FAQ. So, you might get some answers there. Fact sheets by the numbers, fact sheets, all Missourians, how people benefit in different ways. So just a lot of ways to access the information. There's also a lot of social Twitter and for Facebook in particular, active Facebook user, but I can click on one of these graphics, plug it in, it gives you sample words if you don't even know what you want to type in for your post. And you just hit it and go. And so this is a great way to quickly spread the word about the benefits of Medicaid expansion for Missouri. In addition, we have a paid piece to the campaign. So there are videos. We have 3 different videos featuring doctors, business people, and people who would benefit from expansion that currently fall into the gap. Radio ads, print ads, just across the board, a lot of digital. Some of you may have even been like listening to Pandora or reading an article online, and one of our ads may have popped up. I get pretty excited when that happens. But just to give you the flavor of how this is looking, the next slide is going to be a video. It's the doctor's video, just so you can get a sense of what the campaign, how it feels. Okay, well, maybe we don't have the video. Well, I am going to have to say that we do not have the video, and I really apologize. But if you go to makessensemo.org, you can see the video for yourself. And I do apologize for that. Make sure that when I provide these slides, I told Kathy that I would provide the slides. I'll make sure that that video is embedded in there so that you can see it that way as well. Just very quickly, because I want to save time in case there's any wrap up that that Easter Seals wants to do, or if there's any other questions. Just want to be sure that everyone is aware of a couple of resources that we also do have. So we have developed, along with Health Literacy Media and a group called Missouri Voter Protection Coalition, there's some plain language information about registering to vote, how to go to your polling place. There's one you don't see here, but there's also about absentee ballots. And then how do you get ready for Election Day? Also some social media content about this too, which I can share with Kathy, and she can forward on all of these materials, including links to 2 trainings that if you have, I think each one is about an hour and a half, but one is on voter registration and engagement. The other one is on voter protections. And so it surprised me a little bit. It kind of curls your hair a little bit, all the different ways that voting can go wrong, but then there's a ton of protections in place to make sure that everyone has that opportunity, whether they're voting absentee or mail-in or in person. So that is the end of my slides. It looks like Kathy has just put out a last call for questions. So while we'll sit here, I also will say that if you would like to reach out to me, I can be reached at nkelley, K-E-L-L-E-Y, at mffh.org, and I will enter that into the chat just so that you all help. Look at, she's so fast. Kathy has provided that for you all. And so thank you for that, and thank you for this opportunity to share this information. Your distinct focus on people with disabilities and those particular needs and challenges and opportunities really improve my ability to talk about this issue in a more robust way. So I appreciate this opportunity.
Well, thank you so much, everybody, for coming. I'm sorry. Thank you so much, everybody, for tuning into our webinar. We really, really appreciate it. And if you want to watch this video at any time again, please check it out on YouTube. And again, thank you so much, everyone.